Hey guys, welcome back to my YouTube channel Crazy Myths. Today we will continue with pneumoconiosis. In Pneumoconiosis Part-1, we discussed about coal workers pneumoconiosis and silicosis. In Part 2, we will be dealing with asbestosis. What is asbestosis? Similar to coal workers pneumoconiosis and silicosis, asbestosis is also an occupational hazard. It is caused due to inhalation of asbestos, and it is most commonly seen in asbestos sheet workers. Recently, the incident of asbestosis is most commonly seen in people involved in shipping industry. Asbestosis may present as localized fibrous plaques or rarely diffuse pleural fibrosis. It may also present as recurrent pleural effusion. In critical stage, it may cause parenchymal interstitial fibrosis, which is known as asbestosis. Asbestosis is marked by diffuse pulmonary interstitial fibrosis, which is present in the lower lobes of the lung. Asbestosis, therefore, is more common in the basal lobes of the lung, in contrast to coal workers pneumoconiosis and silicosis, which is present in the upper lobes or in the upper zones of the lower lobe. Asbestosis occurs in two forms, serpentine and amphibole, out of which the chrysotile forms of serpentine accounts for 90% of the asbestos which is used in industry. Amphiboles, even though less prevalent, they are more pathogenic than chrysotiles. Being more pathogenic, these amphiboles may cause mesothelioma, which is a malignant tumor of pleural membrane. Chrysotile form of serpentine are slate-like fibers. They are more flexible and they have curved structure. They are also highly soluble. Therefore, they are easily cleared by the mucociliary apparatus. Therefore, these chrysotiles are less pathogenic compared to amphiboles, which are more pathogenic and they are less soluble. Other asbestos-related diseases include malignant mesothelioma, which, although rare, it has great importance in the past few decades because of the increased incidence among the people with heavy exposure to asbestos. Mesothelioma is a diffuse lesion which arises from the visceral or the parietal pleura, and they spread widely into the pleural surfaces. There is also increased risk of developing lung cancer, which is most frequently diagnosed cancer in the world, and it is the most common cause of cancer mortality. It can also cause laryngeal, ovarian, and extrapulmonary neoplasm, including colon cancers. There is also increased risk for developing systemic autoimmune diseases and other cardiovascular disorders. The asbestos is nothing but crystalline hydrated silicates. Therefore, they have same pathogenesis as in case of silicosis. The asbestos particle, once inhaled, they are phagocytosed by the macrophages, which causes activation of inflammasome, which leads to release of pro-inflammatory factors such as interleukin-1 and interleukin-18, along with fibrogenic mediators such as reactive oxygen species, proteases, cytokines, and growth factors. All these cause initial injury at the bifurcation of small airways and duct, where the asbestos fibers penetrate, and these are directly toxic to the pulmonary parenchyma. Both the alveolar and interstitial macrophages ingest and clear the fibers, but long-term deposition of fibers and persistent release of the mediator leads to interstitial pulmonary inflammation and interstitial fibrosis, that is asbestosis. The morphological features of asbestos include asbestos body, as you can see in the picture A and B. Asbestos bodies are golden brown fusiform or beaded rods which have a translucent center, and they consist of asbestos fiber which are coated with an iron-containing proteinaceous material. When inorganic particulates become coated with similar iron-protein complexes, they are known as ferruginous bodies, as you can see in the picture C and D. Another most common manifestation of asbestos exposure is pleural plaque, which are made up of dense collagen which is often calcified. Next is the honeycomb appearance of the lung. With advancement of pneumoconiosis, and honeycomb pattern of lung develops in CT. The features of pneumoconiosis include dyspnea, which is provoked by exertion at earlier phase, but later it presents even at rest, and the cough associated with sputum production, and clubbing of nails, respiratory failure, carpal nail, and even death. Since asbestosis is most commonly associated with lung or pleural cancer, the prognosis is usually worse. And the other associated diseases include Caplan syndrome. It is nothing but pneumoconiosis along with rheumatoid arthritis. The most commonly involved pneumoconiosis is cold-worker pneumoconiosis. Therefore, in general, Caplan syndrome is cold-worker pneumoconiosis along with rheumatoid arthritis. But it may also involve mixed dust, which include silica, coal, and asbestos. Next is the Labrador lung. It is pneumoconiosis of mixed dust, which include iron, silica, and anthophyllite, which is a form of asbestos. Therefore, we'll conclude pneumoconiosis with this summary. Asbestos is more common in asbestos sheet workers, and recently they have also become more common in people who are associated with shipping industry. These more commonly affect the basal lobes, whereas cold-worker pneumoconiosis and silicosis are more commonly present in the upper lobes or in the upper zones of the lower lobes. It usually presents after 20 to 30 years, similar to silicosis, which presents after 15 to 20 years of exposure. Caplan syndrome is characterized by pneumoconiosis along with rheumatoid arthritis, most common of them being rheumatoid arthritis, which is associated with cold workers pneumoconiosis, but it may eventually involve other dust as well. Labrador lung is pneumoconiosis of mixed dust such as iron, silica, and anthophyllite, which is a form of asbestos. Since asbestos and iron are present, the histology of Labrador lung usually presents with ferruginous bodies. Thanks for watching, guys. Hope this video was helpful. Kindly do like, share, comment, and subscribe to Crazy Medz. Stay tuned for more videos.